Today, we're talking about something really serious. It's this idea of a ripple effect, how a single act of violence inside a hospital can spread outwards, and it can actually threaten the very foundation of our healthcare systems. So let's trace that ripple effect and see just how far it goes.
Just look at this number, 87.9%. Let that sink in for a second. In a recent study of healthcare workers in Karachi, Pakistan, that's how many reported experiencing violence while on the job. We're not talking about some rare thing here. For the very people we trust with our health, this is a near constant reality.
Okay, so to really get a handle on the impact here, we've got to first understand just how big this problem is. Think of this as the pebble dropping into the water. This is the initial moment that kicks off a truly devastating chain reaction.
When you hear workplace violence, your mind probably jumps straight to a physical fight, right? But the reality is so much broader. The official definition here talks about everything from verbal abuse to threats and intimidation. It's not just about a single act. It's about the creation of an entire hostile environment that just slowly eats away at safety and morale day after day.
So what does this violence actually look like on the ground? Well, check this out. More than a third of it is purely verbal or psychological. Then you have another third that's this terrifying mix of both physical and verbal attacks. So this isn't just one kind of aggression, it's this relentless combination of threats that attacks the body and the mind.
So the big question is, who's doing this? Well, the data is pretty clear, and honestly, a little surprising. In almost 43% of cases, the violence comes from the relatives of the patients. Think about how incredibly complex and tense that makes the situation. The people the staff are trying to help are connected to the source of the danger.
And again, this isn't some isolated incident. For 43% of staff, these kinds of things happen daily. For another 31%, it's a weekly event. Can you even imagine that? Going to work every single day with that level of threat just constantly hanging over your head. So, that pebble we talked about has dropped. And the very first ripple it creates, well, that's the profound human cost. Let's take a look at the devastating daily toll this takes on the workers themselves.
Nearly 70%. That's the percentage of workers affected by this violence who reported symptoms that line up with post-traumatic stress disorder, PTSD. This isn't just about having a bad day at work. This is an event that causes deep, lasting psychological harm. And hey, look at this number again, 87.9%. We saw it before. That's how many workers in the Karachi study experience violence. Well, it's also the percentage of those same workers who report being absent from work. The connection there is impossible to ignore. They're being forced to stay home to recover, both physically and mentally, from the violence they're facing on the job.
Now this might be the most alarming figure for the future of healthcare. Over half of the workers who experience violence are actively thinking about quitting their jobs, just leaving the profession for good. When our most experienced professionals are getting pushed to their absolute breaking point, the entire system is put at risk of collapse.
But the ripple effect doesn't stop there, not at all. When healthcare workers suffer, their ability to provide care suffers too. This is where the impact gets wider, threatening the health of patients and especially the most vulnerable among us.
The connection is it's direct and it's unavoidable. On one hand, you have violence against staff, which leads to fear, burnout, and widespread staff shortages. On the other hand, that translates directly into a decline in the quality of care for the most vulnerable patients, like mothers and children. You simply cannot have one without the other.
And this isn't just a theory. This is the reality coming straight from the front lines. More than half the staff, 53.1% to be exact, reported that the quality of patient care has gone down in departments like pediatrics and gynecology, specifically because of this violence and the shortages it creates.
So after hearing all that, you might be wondering, is this crisis unsolvable? Well, according to the research, no, it's not. The study actually proposes a clear, actionable plan to calm these troubled waters and restore safety.
The solution has to be a big one, a comprehensive one. It starts with enforcing the laws that are already on the books to protect staff. Then, beefing up hospital security with better surveillance, access control, and more security personnel. But it goes further. You have to train staff with the skills to de-escalate conflict. And even bigger, you have to engage the whole community to rebuild a culture of respect for our healers. And finally, you have to ensure accountability. Create oversight bodies that make sure these efforts are actually working. It's a full plan for real change.
So it all comes down to this really simple but powerful question. When our healers are harmed, who is left to heal us? You see, protecting them isn't just about protecting a profession. It's about protecting our own access to care. It's about ensuring that when we're at our most vulnerable, there is someone there who is safe, healthy, and able to heal us. Something to really think about. Thanks for joining us.